friends. Good morning, good afternoon, or good evening, depending on where you are in the world right now. And welcome to this digital event, Pharmacists' Contributions to Telehealth and Telepharmacy Services, organized by the International Pharmaceutical Federation. Next slide, please. For those of you who don't know me, my name is Lars-Åke Söderlund, and I have the honor and pleasure of moderating this event today. I am one of FIP's vice presidents and also co-chairing the FIP Technology Forum, together with Mr. Jaime Acosta Gomez, one of our speakers today. And on a daily basis, I work as an executive advisor for Apoteket, a government-owned pharmacy chain in Sweden. Next slide, please. Before we start our webinar today, I would like to go through some housekeeping rules. This webinar is being recorded and live streamed via YouTube, and the recording will be available on our website after the event for all of you, of course. You may ask questions using the question box provided, and please submit all your questions in the Q&A box at the bottom of your screen. And of course, we welcome your feedback in order to improve future digital events via webinars@fip.org. And I strongly advise you to become a member of FIP. It is probably the best investment you can make because together we are stronger, and especially when transforming healthcare and pharmacy. Next slide, please. Telepharmacy has gained increasing importance in the delivery of pharmaceutical care, largely due to the COVID-19 pandemic, which has placed enormous pressures on healthcare systems globally. And there are some innovative models of telepharmacy services aimed at optimizing and improving access to pharmaceutical care, resulting in improved patient safety and outcomes. However, despite these benefits, major barriers for implementation of telepharmacy might remain, such as patient confidentiality and privacy of health information. I would like to start by focusing on the FIP development goal number 20, digital health, which is the foundation of FIP's technology agenda. Next slide, please. The FIP development goal number 20, digital health, includes 3 elements of workforce and education, practice and science. And the workforce and education element sets a goal for countries to have enablers of digital transformation within the pharmacy workforce and effective processes to facilitate the development of digital literate pharmaceutical workforce. The practice element sets a goal for countries to have systems and structures in place to develop and deliver quality digital health and pharmaceutical care services through the digital literacy and utilization of technology and digital enablers, configuration of responsive digital services to widen access and equity. And the science element sets a goal for countries to have application of digital technology in healthcare delivery and development of innovative medical products. Next slide, please. FIP recommends mechanisms to support countries in implementing each element of the FIP development goal number 20, digital health. And some of the mechanisms to implement the workforce and education element of these goals are to develop courses, training material, and experiential learning opportunities in initial education and early career training to prepare a digital literate workforce, and to incorporate digital health and literacy competencies and skills in pharmaceutical competency, advanced and specialist frameworks. Next slide, please. Some of the mechanisms to implement the practice element of digital health, the digital health goal, is to demonstrate digital literacy and understanding of governance issues surrounding data ownerships, ethics, privacy, quality information, and have policies in place to support the development of the workforce as managers of health data, and to recognize digital health as a mechanism for widening access and equity, including access to digital pharmaceutical care. And next slide, please. And some of the mechanisms to implement the science element of the digital health goal are to promote the use and interpretation of digital technology and information during training and education of pharmacists and pharmaceutical scientists, and to enable the integration of data science solutions to improve patient care. Next slide, please. The 2030 Agenda for Sustainable Development highlights that the spread of information and communications technology and global interconnectedness has a great potential to accelerate human progress, to bridge the digital divide, and to develop knowledge societies. With the recognition that information and communications technologies present new opportunities and challenges as well for the achievement of all the 17 Sustainable Development Goals, there is actually a growing consensus in the global health community that the strategic and innovative use of digital and cutting-edge information and communications technologies will be an essential enabling factor towards ensuring that 1 billion more people benefit from universal health coverage, that 1 billion more people are better protected from health emergencies, and that 1 billion more people enjoy better health and well-being. And these are the WHO's triple billion targets. So digital transformation of healthcare can be disruptive. However, technologies such as the Internet of Things, virtual care, remote monitoring, artificial intelligence, big data analytics, blockchain, smart wearables, platforms, tools enabling data exchange and storage, and tools enabling remote data capture and exchange of data and sharing of relevant information across the healthcare ecosystem, creating a continuum of care, have proven potential to enhance health outcomes by improving medical diagnosis, data-based treatment decisions, digital therapeutics, clinical trials, self-management of care, and person-centered care, as well as creating a more evidence-based knowledge, skills, and competence for professionals to support healthcare. And this is also the future pharmacy landscape. By this, I think it's time now to jump into today's agenda. And as you can see on this slide, we have a number of highly qualified and experienced speakers with us today in the field of digital health and digital pharmacy. Dr. Derek Monine, Unit Head, Digital Health Capacity Building and Collaboration, WHO from Switzerland. Mr. Ruben Viegas, Practice Development and Transformation Projects Coordinator, FIP, the Netherlands. Dr. Sarah Dining-Griffin, Executive Committee Member of the Community Pharmacy Section, FIP, and Lecturer at the College of Health, Medicine and Wellbeing School of Biomedical Sciences and Pharmacy in Australia. Mr. Jaime Acosta Gomez, Community Pharmacist at the Farmacia Acosta in Madrid, Spain, and also Professional Secretary of the Community Pharmacy Section, FIP. And Mr. Joseph Gui Segura, Vice President of the Hospital Pharmacy Section, FIP, and also Director of Pharmacy and Medicines Consortium of Health and Social Care of Catalonia, Spain. And they will all share their experiences and wisdom regarding pharmacists' contributions to telehealth and telepharmacy services. The learning objectives for today's event are understanding the global role of telehealth in supporting primary healthcare services, identify the current trends in telepharmacy around the globe, and give examples of good practice in telepharmacy. So we will now start our event, and I once again encourage you to submit your questions in the chat in the Q&A box at the bottom of your screen. So it's now my great pleasure to introduce the first speaker, Dr. Derek Monine, Unit Head of Digital Health and Capacity Building and Collaboration from the WHO in Switzerland. And Dr. Monine will talk about the Consolidated Telemedicine Implementation Guide, a global overview. Welcome, Dr. Monine. The floor is yours.
Thank you so much, Lars-Åke, for the excellent highlight in your presentation, which links to some of our key interests at WHO. Really think putting people first and ensuring that we have a health workforce that is digitally literate. We're using the dimension of 4 Ps to identify our audience, which is the people, which is the policymakers, planners, practitioners, and patients. The topic I'll be addressing today is WHO's work on telemedicine. And at the same time, I'll also be addressing WHO's work on the broader agenda of the digital transformation. I have with me a slide presentation that I'll be using to share the highlights from WHO. And I will commence by thanking the International Pharmacy Federation for inviting us to share WHO's work. Indeed, as a secretary to our member states, and also working with non-state actors like the International Pharmacy Federation and our WHO collaborating centers, we truly can achieve the transformation of the health sector using digital. And much more importantly, making sure that we leave no one behind. And as was mentioned in the previous presentation, making sure that we fast track our triple billion agenda, 1 billion people more benefiting from UHC or universal health coverage, 1 billion more people being protected from health emergencies, and 1 billion more people enjoying better health and well-being. Pharmaceuticals are critical, in especially managing patients remotely, which is a topic I'll be addressing in this short highlight. Let me introduce the subject matter is the WHO Consolidated Telemedicine Guide. This particular instrument does not sit in a vacuum, but it is WHO's progress towards supporting our member states to achieve the transformation of the health sector using digital. And I'd like to share the link on this particular slide. It's available on the WHO website. And if you have a smartphone, you can actually take a photo of the QR code to go to the Consolidated Telemedicine Implementation Guide. It is called Consolidated because it integrates past instruments WHO has been using to fast track this particular area of digital intervention. During COVID times, we recognize that digital has been highlighted and that the new normal is actually digital, and that digitalization is going to inform, to a large extent, the delivery of health services as we go towards a more connected environment. A few steps backwards, I'd like to reintroduce the Global Strategy on Digital Health, which is our instrument of work to really put together the global efforts. It has a number of actions for the short, medium, and long term. It also has a number of key actions, 172 actions for WHO as a secretariat, for our member states, and our partners, including the International Pharmacy Federation and other actors that are contributing to this agenda. The strategy itself sits within a period of work that WHO and partners have actually been embarking upon. And this particular journey commenced in 2005 when member states requested the Director General to introduce ICTs in health. It's been almost now 2 decades since this initial resolution on e-health, really calling upon WHO and member states to take advantage of ICTs in the delivery of health services and making sure that we leave no one behind. A few years after that, we had a resolution on standardization and interoperability, which aims to ensure that the ICTs being deployed are interoperable and have integrated within themselves issues around patient safety. In this particular block, a number of telemedicine instruments were developed, such as the 2010 systematic review on the state of play of telemedicine, which I'll talk about in a moment. In 2018, our member states requested the Director General to put in place a global digital health strategy, which sat upon the 2018 Global Digital Health Resolution. It is this resolution that integrates the key aspects that were mentioned by our moderator, artificial intelligence, issues around blockchain, issues around augmented reality in the context of health. So the 2018 resolution is quite instrumental to establish our global strategy on digital health in pursuit of the triple billion agenda as we pursue the 2030 SDGs moving forward. Based upon this, just want to highlight also that these efforts that I've just described are really built upon what we refer to as the enabling environment. How can we deploy telehealth and telemedicine services in such a way that they fit within a country's national digital ecosystem? And the 7 pillars remain relevant in our journey. A is leadership and governance, ensuring that teleconsult, telemedicine, and telehealth are really sitting upon an existing government-led instrument that demonstrates the government's role in terms of leading these particular interventions. Investments is key, making sure that the financial requirements needed to ensure scaling are in place. Services and applications and standards and interoperability, including infrastructure are key to ensuring that countries are able to succeed in establishing teleconsults. As was mentioned by our moderator, issues around legislation, which usually go without saying, but usually go without doing, are critical, including workforce, as was mentioned by the moderator, making sure that competence is expected of health workers, and knowledge, skills, and attitudes in order to deliver telehealth and telemedicine are put in place in a standardized curriculum. WHO is really keen to ensure that we're working with our partners in as far as making sure that we're establishing the enabling environment. Now, in terms of the journey of the consolidated guide on telemedicine, allow me to just recap that WHO's work in this area spans over a decade of work, with the 2010 telemedicine systematic review that provided a definition of what we mean by telemedicine and its interrelationship with telehealth and other disciplines. But more recently, in 2019, WHO released 2 recommendations by which telemedicine and telehealth could be implemented, which are provider to provider telemedicine and provider to client telemedicine. It is these guidelines contained in this WHO document that we recommend to all actors to ingest, digest, and use as a lens by which we implement teleconsults. Sufficient evidence was generated with this publication to demonstrate in what settings telemedicine modalities are effective. The other enabling tools are the National eHealth Toolkit, our Digital Implementation Investment Guide, the Global Strategy on Digital Health I've just talked about, plus several other instruments that have to do with providing means by which we monitor telemedicine implementations, and also recommendations of telemedicine in COVID settings, and etc. It is these varied instruments and more that the consolidated guide on telemedicine is actually built upon. There are, of course, a recap in the guide of what is intended when we say telemedicine. There's also several examples around use cases. And just to make sure we lay the foundation once again, we are dealing with a field that has given tremendous opportunity to connect to the unconnected, to connect to people that have challenges in accessing health services, and at the same time connecting pharmacists to patients that would otherwise not receive the pharmaceutical expertise, especially when done remotely. This is what is meant by telemedicine, really providing healthcare at a distance. And in certain times, we combine telemedicine and telehealth, whereby telehealth becomes a broad umbrella that includes teleeducation, for example, and other modalities of providing care by the non-traditional health providers, such as community health workers and others. A recent term has been virtual health and care. We recently published an instrument with the ITU, really introducing the idea of virtual health and care. It's another phrase, of course, that denotes modalities of providing care at a distance. A number of use cases in the telemedicine integrated implementation guide are described. And these 3 use cases have been used as more common ways of implementing a telemedicine program. Store and forward is a more traditional modality, which is really characterized by capturing an observation and transmitting that observation to an expert. Whereas interactive consultations, which is what we are getting into now with the wide availability of connected services, promises the direct interaction of a health worker, such as a pharmacist, with a patient. And then remote patient monitoring promises the ability for us to provide care in a manner that has not been done before, enabling patients to use medical devices to manage their own care, such as is done in self-care modalities. There are a number of course, use cases that one can describe, including teleconsults, which is really providing the care to clients at a distance, and at the same time provider to provide interactions using tele-expertise, such as telepharmacy interaction with each other, and also teletriage, which is the means by which we ensure fast tracking of patients that need the care urgently. Just want to also, as I conclude, highlight the contents of the implementation guide. There are really 3 phases. And once again, this consolidated guide aims to bring together the different instruments we have at WHO in as far as implementation of telehealth and telemedicine services are concerned. There are 3 distinct stages. The first stage is really concerned about the formative work, situation analysis, forming teams, putting together, modalities of governance and making sure that the ecosystem, the enabling environment is assessed. This is basically speaking to a readiness assessment. And the second phase details those steps that are needed to plan for the implementation all the way up to budgeting, training, and making sure that the investment case is done for that implementation, and ensuring that clients themselves are prepared to engage in a teleconsult, including health workers. This is where the digital literacy agenda also comes to the fore. And lastly is the means by which we assess, did we succeed in the teleconsult? Did we actually make it in terms of those objectives that were described when we started off, in as far as making sure that we bring health care services closer to people? That's the third objective. So in a nutshell, what the guide does is that it takes an implementer through assessing the existing situation, planning in detail for the implementation, and then measuring the success or any lessons learned or challenges or failures so as to improve the particular process. I would like then to invite everybody to look at the teleconsult, at the telemedicine implementation guide on the WHO website or on the link I shared. It is critical that we ensure that we work collaboratively as a global community in making sure that the transformation of digitalization leaves no one behind, and at the same time that we make sure that we ensure digital health brings into play patient safety aspirations and better health outcomes and fast-tracking the SDGs. Thank you so much for listening to this highlight presentation. Over to you, Lars-Åke, for your continued moderation. Thank you so much.
Thank you so very much, Dr. Munene, for this most interesting and informative presentation from the WHO. We have already received some questions in relation to your presentation, and we will answer the questions at the end of the sessions. But I encourage you to submit your questions in the Q&A box at the bottom of your screen. Thank you so very much. We will now continue to our next speakers, Ruben Viegas and Sarah Dineen Griffin. Ruben is Practice Development and Transformation Projects Coordinator at FRP in the Netherlands, and Sarah is an Executive Committee member of the Community Pharmacy section and also lecturer at the College of Health, Medicine and Wellbeing School of Biomedical Sciences and Pharmacy, the University of Newcastle in Australia. And Ruben and Sarah will introduce us to Telepharmacy and Pharmaceutical Care, a narrative review by the International Pharmaceutical Federation. Welcome, Ruben and Sarah. The stage is yours.
Thank you so much, Lars-Åke, for such a nice introduction. It's a pleasure to be here tonight with Sarah and explain a little bit what we did with this narrative review. I will start the presentation and then I'll hand over to Sarah in a few minutes so she can also share the spotlight with me. This title is actually the title of a paper that was published later last year. So Telepharmacy and Pharmaceutical Care, a narrative review by the by FIP, the International Pharmaceutical Federation. And it was published in Farmacia Hospitalaria, which is a Spanish-based journal, together with the colleagues Sarah, Lars-Åke, Jaime, and Giuseppe, who are all speakers in this topic. So the aim of this article was to have a global overview of the different telepharmacy initiatives, or how pharmacy is involved in this new trend. So the telehealth and all the technology is here to stay and will probably only increase in the future. So this was kind of a screenshot on how are we doing and where are we developing as pharmacists initiatives in this area. So a little bit of a contents. You can access the paper via the link here on the screen, the QR code, and you'll find that it has 4 main blocks. So the first one is an introduction, an overview of digital tools, focusing on enhancing pharmaceutical care. So a short introduction on the relevance of the topic. Then a global overview of telepharmacy that has different papers and different examples from across the globe, literally, that you can find different countries with different initiatives. So you can find quite a lot of examples, and you can then dig deeper and read these papers if you're interested. Then the part about implementation of telepharmacy services, and in this block, it's mainly the facilitators and barriers for this kind of services. You can imagine that there are, for example, technology barriers for some countries. There can be some facilitators if there are already networks pulled together, and Sarah will talk about this in a minute. And the last part is a bit on the work FIP has done around telehealth and also future perspectives. As I said before, this topic is here to stay for sure, so we'll need to have more and more conversations on this topic for the future. So the first part, the introduction, focuses a bit on different topics that were already mentioned by Lars-Åke and Dr. Menini. So we have a digital transformation going on. We have big data. We have pharmacies. A lot of pharmacies already collect data. They collect blood pressure data or glucose data. Just imagine if we could get this connected with the GPs, the general practitioners, the other healthcare professionals. If the person goes to their nutritionist and can also have this data input in their system, and everyone will share this data. So this is one of the big topics, the big data. Artificial intelligence can enable also better prescriptions, better review of medicines, and the electronic health records that can be also a very important tool for the future. Wearables and other technologies. For example, in my house, I have a scale that tells me all my body fat, mass, water, everything. So all these devices are already providing a lot and lots of information that can also be used for our health. And also, but last but not least, the workforce readiness, because the future pharmacists will probably need to learn a lot of things that 40 years ago or 50 years ago were not even on the radar. So it's also important to consider this workforce aspect for the future. And I think I will hand now to Sarah so she can continue.
Thank you, Ruben, and good evening, everyone from Australia. So as you can see on the slide, there are many countries in which studies have been identified in the peer-reviewed literature, and I'm going to talk to some of the innovative models on the next slide, which have been evaluated and reported on. So we know that telepharmacy really has gained increasing importance in the delivery of pharmaceutical care, and this has largely been due to the COVID pandemic, which really has placed enormous pressures on healthcare systems globally. And social distancing and isolation also has limited the ability of patients to physically visit pharmacies. However, telepharmacy models have been implemented for decades, and especially where access to pharmacy is really geographically challenging. So what I wanted to highlight on this slide is that telepharmacy really has been shown to have a positive effect on patient safety and outcomes in the peer-reviewed literature. So, for example, a systematic review that was published in 2017 concluded that telepharmacy interventions in outpatients and ambulatory settings had an overall positive impact on outcomes, which related to disease management, patient self-management, and adherence on the management of chronic diseases. While it's important to consider the effect on the clinical outcomes, improvements really might follow from improved processes that deliver more cost-effective healthcare. So some of the slides and studies which identified in our FIP article found that telepharmacy can be effective in improving access to care, reducing medication errors, and improving patient outcomes in remote and rural areas. However, really, it is important to note that research on telepharmacy, while increasing, is still quite limited, and more research really is needed to understand its full impact and implementation in individual countries' healthcare systems. Next slide. Thanks, Ruben. So as mentioned by our speakers previously, there are some innovative models of pharmacists providing telepharmacy services. I won't go into detail as other presentations will cover these in more depth, but I'll briefly provide some of the examples of papers we identified in the peer-reviewed literature. So for example, in China, there is a remote pharmacy service called Cloud Pharmacy Care, which is a medication consultation service system and telepharmacy service model, which is based on the social software WeChat app, and that was developed in China. So the authors of this particular paper concluded that the telepharmacy service model assisted in providing medication management for chronically ill patients. In Denmark, there was a nationwide online telepharmacy chat service, which was developed for all individuals to receive counselling on their medications, irrespective of whether the medicine was purchased as part of the strategy for Danish pharmacies. And lastly, the NetCare program, which is from Switzerland. This was a pioneer initiative of telemedicine and collaborative practice by which the patient and pharmacist consulted with a GP while the patient was at the pharmacy and presenting symptoms. And the GP could issue a prescription and that was dispensed by the pharmacist. So just to mention, while these are a few exciting examples of evidence in practice, the adoption of rate of telepharmacy is still relatively low. So some countries really have embraced telepharmacy while others have been much slower to adopt it, if at all. Next slide. Thanks, Ruben. So the next two slides, I'm going to cover some implementation processes. So with regards to implementation, telepharmacy can be implemented by setting up remote dispensing sites, such as in rural or underserved areas, where a pharmacist can remotely consult with patients and dispensing medication. This can be done using technologies such as video conferencing, electronic prescribing, and remote dispensing machines. It is important to ensure that appropriate regulations and laws are in place to govern these practices, though, and to protect our patient safety, which are should be at the forefront of our thinking. And additionally, the use of telepharmacy should be integrated into the overall healthcare system and coordinated with other providers to ensure the continuity of care that we provide. So on this slide, there are a number of factors that facilitate the implementation of telepharmacy into pharmacy practice. And these include adaptation to future technology-based environments. So with COVID, we've seen a significant increase in the uptake and use of technology for the delivery of healthcare. And therefore, there really will be a need to integrate telepharmacy to optimise the value of pharmacists in improving patient outcomes. And secondly, increased value for pharmacies and pharmacists in adapting to patient needs. So pharmacists may really utilise telepharmacy to increase the time that we're spending with patients, building trust with patients for efficient telepharmacy visits, and also protecting their privacy by obtaining patient consent. The use of telepharmacy also can prevent unnecessary physical journeys to access care, which can result in potential cost savings for the patients. And also pharmacists may need to identify patient preferences and determine whether they would most benefit from a telepharmacy consultation or an in-person consultation in a physical brick and mortar store. Thirdly, which is the enhanced interprofessional care. So as a result, proactive involvement by other healthcare professionals and collaboration in care delivery really should be considered when implementing telepharmacy. And lastly, the increased efficiency of health systems and the provision of patient-centred services. So it has been shown that pharmacists utilising telepharmacy for care delivery in remote locations is more efficient when provided full access to patients' electronic health record systems. And the cost of service delivery also need to be considered when determining cost effectiveness of these services. Next slide. Thanks, Ruben. So lastly, just to finish off, despite the many benefits of telepharmacy services, which I've just outlined, there are also some barriers, which I'm sure you're all aware of, and I'll outline some of those in a moment to implementation. So firstly, outcomes really to its successful use may be influenced by individual health and digital literacy and the extent to which pharmacy is integrated within existing care pathways. Other barriers to implementation also need to be considered, and on the slide, we have divided those into 4 key areas. So I'll just briefly touch on some of the barriers that we identified in this particular narrative review. So firstly, we had technical limitations. Issues such as internet connectivity, equipment failure, and software problems can really impact the delivery of care. Secondly, limited physical examination. So it can be difficult for the pharmacist to perform a physical exam, which could limit their ability to make some accurate diagnoses and treatment decisions. Thirdly, which is the limited face-to-face interaction. And this may limit the pharmacist's ability to build a relationship and trust with the patient and also understand their non-verbal cues. Cost and reimbursement is a big one, and we know telepharmacy can be quite expensive to implement and maintain and ensure its sustainability in practice, and therefore the reimbursement for telepharmacy services may be limited. And lastly is the legal and regulatory issues. So the laws and regulations surrounding telepharmacy really need to be in place, and again may differ from state to state and country to country. So it's really important to consider the policies, the specific regulations and guidelines in each setting, and determine whether we need to develop those and whether those are in place. So in summary, telepharmacy really has the potential to improve our patient outcomes. However, it should be considered as part of a larger healthcare strategy that addresses the specific needs of the population, as well as really looking at the implementation processes to ensure sustainability in pharmacy practice. Thank you, Ruben, and back over to you.
Thank you so much, Sarah. That was very nice presentation of the second and third part of the paper. And what's left for me before we conclude is just present the fourth part of the paper, so a bit of the FIP resources and the future perspectives on this area. So as Lars-Åke already presented in the beginning, FIP has 21 development goals, and one of those is digital health, because this topic is important and this topic needs to be on the priorities for the next decade and beyond. And you can find one of the publications that was recently launched in 2021. So it's the FIP Digital Health in Pharmacy Education, Developing a Digitally Enabled Pharmaceutical Workforce. Because as I said before, the workforce is an important piece for this future, where pharmacists can participate more in digital health solutions, but they need to be enabled. They need to learn how to do this. They need to be familiar with the devices, with the structures, with the new ways of practicing healthcare and new ways of finding solutions for the patients. So this resource is available on the FIP library, so you can find it there. Another resource that is available also on FIP YouTube is the FIP Train the Trainer online course for educators on digital health, capitalizing on the benefits of digital health from early last year. And it's a full course, one bit more than an hour, that you can also consult, and this is an educational piece that is available again on the aspects of education for digital health, which is a big priority for FIP. And as a conclusion, FIP wants to be, FIP is a place where members and pharmacists around the world can sit together, can discuss these opportunities, can share good practices. And the future of healthcare is digital for sure. So all the wearables, all the technologies, they're here to stay. So we need to adapt, and we need to understand how can we be part of this digital future. And FIP is here as always as a platform to develop this area. And I think that's it. Thank you so much. And back to you, Lars.
Thank you so very much, Ruben and Sarah, for this most valuable information. And I encourage you all to download the narrative by FIP and our excellent speakers at today's event. It's a real good overview of the topic and how we actually can proceed forwards. We will now move on to our next speaker. Our next speaker is Jaime Acosta Gomez, a community pharmacist from Madrid in Spain. And Jaime is also the professional secretary of the Community Pharmacy Section FIP. Jaime will introduce us to telepharmacy services, a way forward, the community pharmacy perspective. Welcome, Jaime. The floor is yours.
Thank you, Lars-Åke. Thank you for having me. It's a pleasure not only to share this webinar with panelists I respect so much, but also with so many attendees, many of who I know personally. It's a pleasure to be here with you today. So in the interest of time, I will, of course, start my presentation. I would like first to draw your attention to this report commissioned by the Community Pharmacy Section and was co-authored by Dr. Deneen Griffin, who's our panelist for today too, about how online pharmacies operate and distribute medicines worldwide. It was a global survey that informed our report, and we gathered answers from 79 countries. And we collected different information about e-prescriptions, about, for example, how pharmacists have access to shared patient health records, which sadly and unsurprisingly is still very low, and how can we as pharmacists not have the right information from the patients we are assessing? This needs to be improved. We also asked information about what systems these online pharmacies use to verify the authenticity of prescriptions, the strengths and weaknesses of online pharmacies, and also, among other information, the impact that these online pharmacies have on brick and mortar pharmacies. And if interested, I encourage you to download the report at that QR code. And of course, we also asked information about what other services different to dispensing and supplying medicines these pharmacies offered to patients, like telepharmacy, e-prescriptions, apps, triage, or prescription reminder services and other services. And I must say that I was surprised to find that only 3 countries answered that there were telepharmacy services in place. Numbers cannot be argued. It is what it is. But as pharmacists, it's very surprising that there's not a right assessment of patients, because we know that medicines without the right information can cause more harm than good. And this is the first input that I wanted to provide you with. And I would like you, if you want to scan this QR code and technology works, I would like to ask you if you personally think, despite this less than 4% of telepharmacy services offered by online pharmacies, if this will be be more frequent in the future. Just to have your opinion. Yeah, it's increasing the number of answers. Thank you. And everyone answering thinks that this telepharmacy services will be more frequent in the future. So this gives us a push to be better informed and to try to adapt to this, I was going to say new reality, but it's not new anymore, I think. So, and the FIP is trying to provide you with the resources to better equip you to provide this service. So regarding the telepharmacy services, the advent of COVID-19 accelerated changes that made not only telepharmacy a reasonable option, but more widely, pharmacists were able to provide more services to patients because of COVID. And I'm not talking only about, of course, testing and vaccinating. I'm talking also about prescribing, substituting prescriptions, renewing prescriptions, medicines use reviews. Healthcare systems really, in many places, took advantage of the capacities of community pharmacists for the good of healthcare systems and patients, but also in the sense of telepharmacy. For example, it was mentioned before, in the United States, the relaxation of regulations allowed pharmacies to utilize inexpensive teleconferencing platforms that can also be used in less resources settings if regulation allows, such as Zoom or Skype, which would have otherwise been non-compliant with privacy standards. Additionally, emergency legislation allowed pharmacists to perform COVID-19 related activities such as COVID-19 testing, vaccinations, and telepharmacy regardless of individual state laws. So COVID changed this completely. Though these changes made telepharmacy more accessible from legal and monetary perspectives, they are not permanent, nor did they provide guidance for implementation. Talking about China, during the COVID-19 pandemic, a remote pharmacy service called Pharmacy Care, based on the social software WeChat app, was quickly constructed and applied to solve the medication-related problems of patients and the public during home quarantining. It would be nice to know how it's working now in the current situation in China. This timely and interactive consultation model helps to carry out medication therapy management for chronically ill patients and improves, it's shown in the evidence, improves patients' medication compliance, improves medical quality, and plays a positive role in promoting safe medication knowledge. In the next slide, I bring you the example of Canada. Sorry for the very busy slide, but this gives a sense of the advances that in all states in Canada or regions allowed pharmacists to do more and do better because of the regulation changes. So there are many exceptions in place because of COVID-19 pandemic, and after while we are hopefully in the way out. It's been a long time, but you can see in the map on the screen the new services that were enhanced, remunerated, or simply expanded. So talking about telepharmacy, since the COVID-19 pandemic, and this is one of the very few positive outcomes of this very sad pandemic, pharmacists are being able to provide virtual counseling, to provide virtual telephone assessments in order to prescribe. So they are distantly prescribing. They can provide virtual de-prescribing consultations, provide virtual smoking cessation services, provide reimbursed medicine use reviews if those services cannot be delayed. And something that I found very interesting, for example, witnessing distantly the ingestion of opioid agonist treatments, or demonstrating distantly the use of a medical device. Still not very complex new digital services, rather adapting an analogic service to a digital one, but I think it's very interesting. And one of the barriers that was described by Sarah and Ruben before, among the technological, organizational, and human barriers, I think I tried personally a couple of times before to provide telepharmacy service from my community pharmacy. And once that regulation allows it, I think that the economic barrier, I think, in my experience, has been the most important one. And that's why I bring it to you here, because the startup of a telepharmacy scheme involves considerable time, effort, and money. Pharmacy remuneration models must ensure the sustainability and profitability of pharmacies and the basic services they provide. Payments for additional services must incorporate the resulting costs while providing the right incentives for the implementation of these new services. The lack of reimbursement models for telepharmacy is a key challenge. And telepharmacy might not be included in the portfolio of administration services, and therefore lacks many times a well-defined and explicit economic framework to which all organizations can adhere. This is widely considered the most important barrier for implementation into usual practice, and that this is the one I encourage you the most to overcome when trying to implement a telepharmacy service if interested. So I'll bring you a few examples of what I like when checking the evidence and information available. For example, our colleague on the left side of your screen, this is a screenshot from Chemist and Druggist magazine from the UK, and it's about the One London Pharmacy Group making more than 8,000 Great British pound per year with the rise in demand for virtual consultations. And I'm pretty sure that this allows pharmacy owners to invest in these services and improve the quality of these services. I think this is very important. On the second example, the Pharmaceutical Society of Australia recently launched in October 2022 the Tasmanian after-hours advice line to support the health and well-being of all Tasmanians when their regular pharmacy is closed. So this Tasmanian government-funded advice line is now available to all Tasmanians seeking support or advice from an expert pharmacist from 6 p.m. to midnight, 7 days a week. The advice line is being tried out now until 8 months. The third example that was also briefly covered by Dr. Deneen Griffin comes from Denmark. In collaboration with the Association of Danish Pharmacists, Danish community pharmacists provide access to medicines via the internet at the provided link in my slide. Medicine purchased at this website is delivered by post or picked up at the customer's local pharmacy. To ensure proper use of drugs purchased at the website, which is fundamental, an online pharmaceutical counseling service was introduced in February 2012, so this is not new. Via a pop-up notification on the website, all customers are advised to seek counseling by telephone, video, or chat. This counseling is not only available when making a purchase, but also directly from the front page of the website. And the last example in this slide, the one on your right, is from Aspen RX Health, which is a healthcare technology company that uses artificial intelligence to improve medication adherence and patient outcomes. They offer a platform that integrates with electronic medical records and uses natural language processing to analyze patient data and identify medication-related issues. What they do, basically, this is a new business model that match on-demand pharmacists with specialties with the right patients under a gig economy model, diminishing the cost of healthcare plans that contract this company to provide pharmaceutical services to their patients. So coming to the end of my presentation, I thought that video speaks more than images and more than words, and I wanted to show you this commercial ad from a private insurance company from the US, which I'm not affiliated with, that I think that I've used this video a few times before in different presentations, and I think that it explains very well how a telepharmacy service works. So I hope you can hear it.
A retail telepharmacy, or remote dispensing site, is a licensed brick-and-mortar pharmacy staffed by one or more pharmacy technicians. A pharmacist supervises the technician from a central verification site. This model enables a telepharmacy to operate in areas where a traditional pharmacy is not feasible. Let's look at how a telepharmacy works in 4 simple steps. Prescriptions arrive at the telepharmacy electronically, in person, or by phone. The technician enters the prescription information into the system, which is then verified by the pharmacist. The technician and pharmacist can easily communicate via secure connection at any time. Telepharm's remote dispensing software integrates with pharmacy management systems for a seamless, real-time experience. After the pharmacist verifies the data entered, the technician prepares the prescription for dispensing. The technician captures high-quality images of the prescription label, physical drug, and medication bottle for the remote pharmacist to review. A telepharmacy operates like a traditional pharmacy, except the pharmacist reviews prescriptions and counsels patients from a remote location. The pharmacist reviews the prescription by analyzing images sent over by the technician. They also reference the patient's medication profile for drug interactions and other potential side effects. If approved, the technician places the medication in will call, pending consultation from the pharmacist. Telepharm software requires that the pharmacist counsels the patient before the patient picks up their medication. During counseling, the remote pharmacist has all necessary patient information, even medication history, available on the screen. Patients can also use this secure video connection to get answers for non-prescription related questions. After counseling, the technician completes the transaction at the register and the patient receives their medication. A telepharmacy provides all the care and services of a traditional pharmacy. Telepharmacy, my local pharmacy, convenient and safe.
So after seeing this video, I think I'm very proud of the service I provide in my pharmacy. We try to do our best to provide the patients with all the information they need and to make the most of their medicines and to improve their health. But I think that this telepharmacy service, there are many models for providing telepharmacy. Maybe this is one of the, I think, basic ones. But compared to how I provide care in my pharmacy, I have a few differences. For example, the pharmacist in this example follows a standard operational procedure, and the pharmacist that assesses the patient can be specialized on the illnesses of the patient and or the treatments of the patient. The pharmacist has access to clinical data, the electronic health record of the patient, and systematically checks for interactions and is completely try to be assured that the medicine is going to potentially be beneficial and safe for the patient. And I think this is also a very big difference from how I provide care in my pharmacy. Everything is recorded, not only the dispensing and the logistical process, but also the actions of the pharmacist, including the provided information that the pharmacist provides to the patient at the end with that clinical conversation that they have. Everything is recorded. And this is very good in terms of quality, of course, and patient safety, because if there's any mistake, any error, any harm to the patient, the process can be improved all the time. And also, of course, I think this is, in my opinion, very efficient because the same pharmacist can provide care to different locations. I wouldn't allow myself to call them pharmacists because there are no pharmacists inside. So to me, that's not a pharmacy. But I think it's much more efficient. And lastly, to finish, I would like to also ask you again to provide us with your opinions. Here you have a QR code that you can scan. Please, if you can type what you consider the biggest advantage of telepharmacy services and the biggest disadvantage, if any, of telepharmacy. So if this works, we should be seeing your answers live on the screen. It's not working. Let me check. So you can please try. Oh yeah, here it is. Okay, so in the interest of time, I'm a couple of minutes late. And just for you to think personally about the advantages and disadvantages of telepharmacy. And this has been all for me. And thank you for your attention. Happy to answer your questions, if any, at the panelist final time. Thank you.
Thank you so very much, Jaime, for this interesting presentation of different telepharmacy services. It is actually true that the COVID-19 pandemic triggered a dramatic decline in operations for many businesses, but thankfully pharmacies were not among them. And when social distancing and you can say shelter-in-place orders closed the doors of non-essential businesses, pharmacies found themselves being utilized and in very new, innovative ways to provide expanded and enhanced care to our clients. And in some countries, as we have seen, these pharmacy models now are fundamentally changing the part pharmacy plays in healthcare for the better. So we have now come to our last speaker today. Our final speaker is Mr. Joseph Gui Segura, Vice President of the Hospital Pharmacy Section in Europe and of the FIP, and also Director of Pharmacy and Medicines Consortium of Health and Social Care in Catalonia, Spain. Welcome, Joseph, to talk about telepharmacy services, a way forward, the hospital pharmacy perspective. The stage is yours.
Thank you, Lars-Åke, for your kind presentation. Sorry. Well, in last year in the hospital pharmacy section, we analyzed the perspectives, the future of the hospital pharmacy in our section and also worldwide. And what we observe is the emerging trends in the hospital pharmacy. And these emerging trends are related to patient-centered care. Hospital pharmacies, we want to reach or to be more close to the patients, to provide more patient-centered care assistance. Also, the introduction of new technology in the healthcare system, not only innovative drugs, but also innovative drugs, but the introduction of artificial intelligence, robotics in the hospital pharmacy and also in the hospitals, in the healthcare system. And also we have a challenge of the workforce sustainability and development because of the innovation, because of these more specialized, more complex drugs, also we need more specialized pharmacies, more super specialized hospital pharmacies in advanced therapies, in gene therapy, in management of chemotherapy, in oncology, in pediatrics. So we have these three different challenges. The ultimate goal is to converge in utilize the pharmacist's full clinical expertise, these hospital pharmacies or the pharmacist's clinical expertise to provide the best patient care. And telepharmacy is something that gathers and can help to manage these three main challenges. Is a practice model that adds value to the hospital pharmacy practice in the new challenges of the hospital pharmacy. And the hospital pharmacy section, we elaborated an aspirational goals, the basal statements, which are aspirational goals for the future of hospital pharmacy. They were elaborated in 2008 in Basel. So this is because we call them the basal statements. They were reviewed in 2014, and now we are currently in the process of a new update of the basal statements. These aspirational goals for the hospital pharmacy, which will be working in Brisbane, in Australia, in the next FAP World Congress in Brisbane, Australia, in September. These basal statements, they provide statements for hospital pharmacies to improve their practice at the maximum scope of their practice. They are divided in different domains: ranking statements, administration, procurement, influences. They are fully available on the FAP website. There is no login, no password required to access to these statements. And also there are some documents, some publications that are related to them. There are now currently 65 statements, and some of them are related to the also telepharmacies. But because telepharmacy, or the use of technology to provide clinical pharmacy services and pharmaceutical care, is not the ultimate goal, the technology. The ultimate goal is to provide the best patient care and to provide the maximum scope of the clinical pharmacy services. So to be accessible as a point of contact for patients and also for healthcare providers. As hospital pharmacists, we work in the hospital, and part of the multidisciplinary teams, the main part of our work is to work with other healthcare providers like physicians or nurses. Other institutions like the American Society of Health System Pharmacies, they are also looking for the future, and the Practice Advancement Initiative 2030, it's the goals to be reached, or how they see the profession in 2030. And they have a specific statement about telepharmacy. Virtual pharmacy is services should be deployed to optimize operational and clinical services, to tend the patient care services, and to enhance the continuity of care. This is the main challenges of the hospital pharmacy, to optimize the operational of all the services to provide into the hospital, and also to reach the patient, and not only the hospital, out of the hospital, and in conjunction collaborating with other healthcare facilities and also the community pharmacy. In 2017, and the American Society of Health System Pharmacists, they launched a statement about telepharmacy, which was updated last year in July, and changing the concept of telepharmacy to telehealth pharmacy practice, because it's maybe the telepharmacy is not the full scope of practice that hospital pharmacies and pharmacists can provide. So they adjusted this the concept to telehealth pharmacy practice. Although the applications of telepharmacy or telehealth pharmacy practice are the same. And from the US perspectives, telepharmacy can help for the medication selection or the review in remote or the reviewing of the prescriptions, also to have the dispensing, like we have seen just a few minutes, the same as community pharmacy. Also to review and to help the admixture verification, because in rural areas, maybe it's difficult to have a specialist pharmacies in compounding, but to provide these remote or telepharmacy services can help to extend the clinical pharmacy services to modern locations. Also for the follow-up and patient counseling and monitoring, especially in oncology patients, that they can maybe they have not to go to the pharmacy, and also they can ask about problems of the medication or the adverse effects to the pharmacist with the telepharmacy and as a tool, and expanding pharmacy services to other locations and also to other areas of the practice. It is important also to highlight the aspects that they have to be taken into account for the implementation of telepharmacy, like the regulation at national level, regional level, and also at local level, because telepharmacy cannot be implemented without looking for the accomplishment of the regulation. Also, the reimbursement for telehealth pharmacy practice, it's an important thing to think about, because it's a different practice, but also it provides added value to the patient. And to be sustainable, it also has to be considered in the reimbursement model of the hospital pharmacy. It's important also the telehealth infrastructure, not it's always easy or fulfills the regulation to use like platforms like Zoom or Skype to provide this service. So sometimes we have to look for specific healthcare platforms or infrastructure because of the security of the information, and also to be aware of the cyber security, and to avoid hacking, to avoid the lack of sensitive data of the patients from the healthcare facility, and also to think about the patient-centric considerations for the telehealth pharmacy visit. Not all the patients, they have the digital health literacy. Not all the patients are the best candidates for this service. Some patients, they still be candidates for face-to-face pharmacy interactions. There is also a statement from 2020 from the Spanish Society of Hospital Pharmacy. In Spain, after the COVID pandemic, we highlighted the role of the telepharmacy in the monitoring of outpatient patients and the pharmacotherapeutic follow-up of these patients, looking for interactions, monitoring adverse effects, and also to provide this patient education, the clinical coordination with other healthcare providers, and from the hospital perspective, also to provide a home drug delivery, but informed through the telepharmacy. And this is my last slide, and I would like to highlight that the importance of the measuring the services we provide as pharmacists. You can manage what you do not measure, but it's important to for improve the pharmacy practice to measure, but also it's important to measure to demonstrate, to show up the value of our interventions as pharmacists about the benefit that we provide and on the care we provide to the patients. So this is a set of indicators, 50 indicators, maybe they are too much, but it's important to highlight there are different indicators, KPIs that they can help us to record and to register these interventions, this practice, and to improve, because we have recorded them, we can analyze them, and so we can set up new interventions, set up new indicators, and also to show up to the decision makers, also to our managers about which is the workload of the telepharmacy and which is the value of these services, the new services that we are providing to our patients. And thank you for listening, and we're happy to answer all the questions.
Thank you so very much, Joseph, for sharing how telepharmacy services are part of the hospital pharmacy, but also how they actually increase patient safety and how they are more a part of a virtual delivery of pharmacist care at the hospital, a deeper and perhaps more clinical perspective of the hospital pharmacy. Thank you, all the speakers. Can I now ask you all to turn on your cameras, as it is time for the question and answers part of today's event. And I will start with the first question to Sarah. There is a question about the teletriage. How can actually pharmacy be involved in teletriage? Do you have any suggestions or ideas around that?
Yeah, thank you, Lars. So I think, I mean, it's important that pharmacists are supported in providing these services. So, for example, I think there was a question that came through around the support from professional organizations. So I think first and foremost, we need support from professional organizations and the appropriate regulations and legislations and policies in place to provide these particular services. From a pharmacy-based perspective, I think there are a number of implementation factors which I covered. So understanding the implementation requirements from a pharmacy perspective is quite critical in order to implement in routine pharmacy practice and in order to ensure the sustainability. For example, one of the implementation factors, which I did cover in the presentation earlier, was around remuneration models. So thinking about the remuneration models that are associated and linked with telepharmacy to ensure sustainability is also very important. So thank you, Lars.
Thank you so very much, Sarah. We have a question from Nilan Usman. She's saying that pharmacists have already been providing telepharmacy services and patients give a call to ask for advice, or they text via apps or like WhatsApp. But at the same time, pharmacists are not full on board with telepharmacy services. Any recommendations to solve this dilemma and convince pharmacists or pharmacy bodies to implement telepharmacy services in a systematic way? Ruben, would you like to ask that question?
Yes, thank you, Lars, and thank you, Nilhan, for the question. I think one big aspect that is in this question is that we already, for example, if you send something via WhatsApp, there's probably you don't know who owns the data privacy aspects, who stores the data. So I think there's still a lot to do in this area of data security, so to say, so we can be sure that the channels that are being shared between the healthcare professional and the patient are safe, and this information will stay there and will be maintained there only for the purpose of the healthcare consultation. And following these, the recommendations, I think, would be focusing on, as Sarah said, the regulations. So when the regulations are clear and in place, then it's probably easier to enable more of these services, as long as we keep doing our part and also providing cost effectiveness and provide data of the services and of the models. I think that would be my share to it.
Thank you. Anyone who would like to add a comment to Ruben's answer?
Yeah, Lars, if I may chip in there.
Yes.
Yeah, I mean, at WHO, we've seen this trend. They are informal, interactions taking place. We call them informal. In our last survey on telehealth in 2015, we sort of like classified these teleconsult, telemedicine, telehealth interventions as being formal and informal, and there was a third parameter. It's true that these are taking place, as the person has mentioned. What is needed, as Ruben and perhaps Sarah have mentioned, is really integrating this within the government delivery mechanism so that it is regulated. Without regulating this aspect through a national strategy or a national health policy, adverse results might actually take place, including litigation, right? And so it's critical for us to recognize that the digital transformation agenda is going very fast. I mean, 20 years ago, we never thought that mobile phones would be used as a modality of telemedicine. 20 years ago, we were really thinking about TVs, right? And clinicians speaking through a screen. That was a modality. But the transformation we're seeing is moving very fast. And so the regulations must also catch up to ensure patient safety modalities are in place, and also protecting the individuals that are involved in the interactions with the patients. So regulations, patient safety, these are key items to consider. And as Sarah was articulating, part of it has to do with the digital literacy, because if you do not have a digital literate workforce, they'll not be able to translate what is expected of them from a legislation perspective into practice. And that's why the digital literacy, Lars, we're talking about, is critical, because it also informs the do's and don'ts for the health workers and pharmacists, so that whenever such an informal implementation takes place, they'll be the first responders to call upon governments to regulate these particular informal interactions on telecare. Lars, thanks for the airspace, and back to you.
Thank you so very much. I would like to address another question to you as well, and also comment upon those 20 years. Perhaps from 5 years from now, we will not say telepharmacy or digital health. We will just say health and pharmacy, because it's a standard. But anyway, how can we incorporate telepharmacy in a low and middle income country where there is no electronic health record, or perhaps where there are very scarce resources to develop telehealth and telepharmacy? What are your thoughts about this?
Thank you so much, Lars.
Yeah,
it's a critical question, actually, because LMICs have sort of like been struggling in terms of getting ahead of the transformation. But we do see opportunities, especially in MICs. For example, mobile connectivity. Many LMICs are actually succeeding with connecting individuals using mobile telephony. And so there are opportunities to connect, the unconnected through basic features like SMS, for example, USSD codes. These opportunities must be leveraged, because I think tendency is to assume nations are at the same level. And so the issue around LMICs is really making sure fit for purpose interactions for teleconsults are in place, like SMS, for example, USSD codes, and artificial intelligence can actually be leveraged with these basic feature phones. The issue of electronic medical records is really a key component to teleconsults, because it's a home of the digital registration of that interaction. So indeed, the issue around medical records is key, but it's not an essential component of a telemedicine interaction. What is critical is to make sure that the health seeker is connected to the health provider using those modalities that the health seeker, the patient, is competent at. And at the same time, taking advantage of the literacy of the individual that we're asking to engage digitally. And so there is a lot of opportunities in LMICs, especially to leverage emerging opportunities like SMS, the wider availability of mobile phones, and etc. And so once again, the end product should be governed by the needs of the people on the ground themselves in terms of the sophistication of the telemedicine consultation. Thank you so much, Lars. Over to you.
Thank you so very much. Yes, thank you. And also, I mean, we sometimes might perceive that we're talking about really, really high tech. But I know, especially from the World Health Assembly in Geneva last year, where actually the health minister of Malaysia talked about the use simple technology like SMS to send out to all the population, and they got almost everyone in the country vaccinated against the COVID. Simple messages. It's a lot about behavioral sciences, you can say. Well, clinical pharmacy services executed by the pharmacist in hospital, but not directly in a bedside. Can those be classified as telehealth pharmacy services practice? What do you say, Josef?
Well, yeah, pharmacists, we have worked remotely in the hospital facility during many years, especially after the introduction of electronic prescription. But I think telepharmacy is more considered where you are out of the facility, not in the facility, but because you provide remote clinical pharmacy services, not when you are in the hospital.
Okay, thank you so very much. Jaime, we have a question from Sumarno Marno. What is the cost comparison? Do you know anything about this between pharmacy, telepharmacy, and conventional pharmacy services? How about guaranteeing the safety of the medicines or patient medication safety? Any ideas or thoughts about this?
Yeah, there's evidence that in general, digital health provides more convenient care to patients, which is a very big driver for implementation and sustainability of the services, better outcomes, and also efficiency in the healthcare industry. In the example I provide you with, it's the same pharmacist servicing different locations. So in that sense, it brings a lot of efficiency. So it's not just about providing new complex clinical services run by machine, which will be the case in the future. We're seeing that already in the pharmacy area. Chatbots, for example, answering questions about medicines, interactions, etc. But that is going to push pharmacies to provide more value to patients and healthcare systems. So as a profession, I think there's a great opportunity for us in leading the change that healthcare systems need.
Thank you, Jaime. Ruben, will FIP be producing digital tools for pharmacy services such as new medicine service, use review, medicine use review, or education on different diagnoses that can be used universally across all settings? Have we been thinking about that?
Thank you, Lars, for the question, and Shyam also. Just a side note before I answer the question, that there's a newish publication about medicine review, the traditional one, so to say, that was launched early last year, I think. So I can look it up and put it here. But of course that there will be more and more resources in the future about this area, because as I said before, this is the future, this is here to stay. So FIP will also have to understand what are the needs of the members and which resources would need to be developed to support the members to develop these kind of services in their countries. So I'm not exactly sure which area will be the first ones, but I think for sure the future will hold many resources in this area.
Thank you. Dr. Derek, from your perspective, we talked about the low and middle income countries, and we saw some high-tech examples from USA in Jaime's presentation. Which country would you say is a country to follow, to learn from when it comes to low and middle income countries? I read a couple of years ago about Rwanda being one of the top 10 countries in the world. We know about Estonia, almost totally digitalized society. Which are your recommendations for us to follow if we would like to learn more about different development in this area?
Thank you so much, Lars. I would, echo what you just mentioned, but perhaps take opportunity to announce a recent publication that we supported, which has a number of use cases and country examples on the state of play of virtual care. This was a recent publication published by WHO, the International Telecommunications Union, and the Novartis Foundation. It's called Virtual Health and Care. and has a number of case studies, including Rwanda, for example, the Babylon Telemedicine Consult, which is really machine driven by artificial intelligence. It's a chatbot that provides triage services to the population in Rwanda. And Rwanda, of course, has been a key example, amongst others, on what a country can do in terms of innovation. They have an artificial intelligence center and other innovative approaches around digitalization. And Estonia, of course, is another great example when it comes to interoperability of health services and systems. On the far east, you have countries like Australia that were quite, instrumental in terms of demonstrating the fact that you can actually provide patient health records, health records that connect people to their medical records and providers. It's called the e-record system that Australia has been deploying for quite some time, and is documented in WHO publications. The publication on e-health for universal health coverage of 2015 I talked about contains that particular example. And of course, India is an emerging illustration with e-Sanjini, and my apologies if I mispronounced that particular tool. It's a government-led teleconsult, telemedicine implementation that emerged during COVID times and has seen tremendous uptake driven by the government. We're basically working with the Indian Ministry of Health to integrate that telemedicine platform with the disability aspects. This is basically taking the teleconsult agenda to individuals that may have limitations in terms of interaction due to disabilities. So there's a use case that we are working with the ITU and the Ministry of Health in India. So there's quite a number. I would point listeners to the publication I talked about, Virtual Health and Care, published through the Broadband Commission, which was, this particular report was led by WHO and the Novartis Foundation. It has a number of case studies that I would point readers and viewers too. Thank you so much, Lars, and back to you.
Very interesting indeed. Sarah, you are a lecturer at the university, but you're also highly interested and experienced in telepharmacy. Would you think that it can be possible to see cross-border remote clinical pharmacy services coming into play? I mean, for example, a patient speaking to a diabetic expert pharmacist in Australia, but staying in another country. Would you see that possible?
Thank you for the question, Lars, and thank you to the audience for that question. I was having a think of this when the question came through, and I think cross-border telehealth really can present a variety of regulatory and legal challenges, particularly around data privacy and reimbursement as well. And I think in order to address these challenges, we really need to be thinking about, I guess, how governments and healthcare organisations and our professional organisations may need to collaborate to develop and implement policies or procedures that ensure the safe and secure telemedicine and telehealth across those borders. So I think also additional to that, healthcare organisations may need to invest in potentially new technology and infrastructure to support the safe delivery of these services across borders as well, including the secure data transmission, which was mentioned in a few of the presentations, and the virtual consultation platforms that we use.
Thank you. Thank you. Two final questions, one for Jaime, one from Joseph. And please, a short answer because time is running out. But Jaime, what is the role of the future digital pharmacist, community pharmacist?
Well, I see as there was a presentation at that FIP conference called Pharmacist as the game trying to involve patients with digital health solutions, and that's we at the same time we need to have we have to be very sure of the evidence of the products we dispense. We have to be very sure that patients use evidence-based digital health tools. There are not many of them, and I see that as our biggest role in that, supporting patients incorporating digital health tools based on their evidence.
Okay, thank you. Joseph, what is the future, the role of the future digital hospital pharmacist?
Well, hospital pharmacists will have to be digital for sure, not only for for remote or online services to outpatients, but also for the coordination with clinical teams and the cooperation with including other hospitals and expanding the network of cooperation between the healthcare system. So we have to be digital, and that's not other way.
Yes, of course, and the digital is a tool to increase safety, to follow up on adherence, etc. So it's the most valuable tool for pharmacists in every setting. If we can have the slides again, I would like to thank our fantastic panelists for their most valuable presentations and for sharing their experience and wisdom, and for, you can say, showing us the path to the future, but a future that is already present in so many different countries. Thank you so very much for your contributions. And it is both clear and evident that digital transformation impacts healthcare through technology, and telepharmacy is set to become one of the most important aspects of telemedicine in the years to come, with its ability to provide patients with increased and more timely access to pharmaceutical care, reduced costs for individuals and health systems, improved patient satisfaction, experience and convenience, and of course, better health outcomes. And telepharmacy has gained increasing importance in the delivery of pharmaceutical care, largely due to the COVID-19 pandemic, which has also placed enormous pressures on healthcare systems globally. But pharmacists play a critical role in healthcare delivery today, and the local pharmacy is a mainstay of the community, serving as a convenient, accessible destination for a wide range of healthcare services and wellness needs. And technologies such as robotics, automation, machine learning, and artificial intelligence will also help power our approach to dynamic workload sharing, where certain parts of the pharmacy workflow can be completed virtually, as we saw in this presentation from USA, and where pharmacists can have a more direct interaction with patients, where we can serve our patient where and when they need us most. So the future of pharmacy and pharmaceutical sciences is digital, and it is extremely exciting. And a digitally enabled and agile pharmaceutical workforce will capitalize on the benefits of digital health to serve the higher purpose of providing good health and well-being for everyone, leaving no one behind. And we will dig into digital health and digital pharmacy a lot this year within FIP. And we will also try to answer all those questions that were not possible to answer today. But this is a very important area of our practice, and we will follow up with more digital events during the first and second quarter of this year, as well as a special event at the World Congress of Pharmacy in Brisbane this year. So stay tuned at the FIP website and our social media profiles for the coming events. So thank you all our speakers for a fantastic presentation, and thank you all of you for joining us today when we create together the path towards the future of pharmacy practice. Thank you so very much, and good afternoon.
Take care. Bye-bye.